Welcome back YouTube to my channel of an everyday life of an Aspie. If you're new to my channel, I'm Aspie. I'm all about creating mental health and awareness versus sharing my life stories of Asperger's syndrome and anything that comes in the territory of Asperger's syndrome. I also talk about some other mental health issues with the tips and advice, or shall we say tips and advice on anything that's health related, so that you guys can actually, follow through it, or just, like as I said so many times before, if you see someone that doesn't seem right, sort of thing, seek professional help for that person basically, or seek an opinion if you feel some of these ain't right for you. Because as I said before, some of these management tips that I may give out in some of the series, regardless what it may be, will work for me but may not work for you, and vice versa. Some of the things may work for you but not for me. It's just a matter of just creating a balance and harmony between us, and just knowing what works and what doesn't work, and actually accepting each other's differences of opinion. If you've been following me right now, I'm doing the Let's Talk series, and I've just finished up the parts about the Let's Talk education series, and now I'm going to be bringing out the Let's Talk in the base of health, which is going to be covered in a spectrum of about the men's health, because as we know, basically at this point of time, as I believe and I'm aware, that not many people do talk about men's health in general, because there could be valid reasons for that, or just some reasoning behind why it's not been talked about much. Maybe there's not much awareness about men's health more than it has been in women's health in general around the world. And also basically, for another one, for some men, or majority of men, maybe they're just thinking that, of their pride and ego, most likely, that they think they can do everything on their own accord and they don't have to ask for help. But then again, maybe they're afraid of asking for help. I don't know. It could be just this generation, how it is that you do things on your own and not to bother about asking people for help, because then it makes them feel like that they're vulnerable and weak, when that myth is not 100% true. So this one's basically been broken down into obviously different parts of these mental health series, especially because I felt in my heart to address these, especially because, as I said, that not many people be talking about the men's health in general. So I'm hopefully some of these series in the Let's Talk men's health series, especially of what I'm going to address, hopefully, and I'm predicting this time, I can't always guarantee it, maybe 3 weeks these series will be running of what I'm going to be addressing to you all. I can't promise you if it is going to be 3 weeks, but I'm hoping some of these will be informative and educational for you all, and hopefully some of this will be used as an educational tool and resource, regardless what it may be of these topics. So in all further, this is going to be the first part, men's health, about bowel cancer. So let's begin this before I run out of time. As you're aware, basically, bowel cancer I'm going to be bringing out obviously through statistics of New Zealand, not America and all that, since I'm located in New Zealand, so hopefully I don't avoid any confusion. So I humbly apologise for you all, but it still should give you a rough idea of what I'm addressing. So as we know, bowel cancer kills more men in New Zealand than prostate cancer alone. Yet if it is detected early enough, 75% of all bowel cancers can be cured or managed or what have you. But then again, many people may suspect that, for this, the earlier the prevention, the better. So, people may ask, what is bowel cancer? Bowel cancer is also known as colon cancer, rectal cancer, or colorectal cancer, depending on where in the bowel the tumour is located inside the body organ. Bowel cancer develops when lumps or polyps in the bowel turns cancerous. Lots of people have polyps, and most of the time they won't turn into cancer. Removing polyps, whether they are cancerous or not, can stop the bowel cancer from developing or even returning, but it can't always be guaranteed. The signs and symptoms to be looking out for, there are a few things that we should be looking at, obviously, when it comes down to this, for the bowel cancer and every other, form of disease that we may have. And the most common ones maybe that you look at is bleeding from your bum or in your poo. Number 2 is needing to poo more often. Number 3, having runny poo for several weeks on end. Number 4 is lumps or swelling in your tummy. And number 5, weight loss. Who gets it? Okay, obviously it's been known that bowel cancer is most common in men over the age of 50, however, but it can affect men of all ages, however. Your chances of developing this is increased if you consume alcohol, smoke, cigarettes, are overweight, exercise very little, and consume a lot of red meat and processed foods. Sometimes also with this, like anything, bowel cancer can be hereditary. If someone in your family has bowel cancer, you have a high chance of developing it. Okay, getting tested basically, there are certain tests out there that is available basically, and if you're like a male that is basically over 50 years of age, they recommend that you get tested for bowel cancer every 2 years. Your doctor can organise a bowel screening test for you. The screening test is called a fecal ocular blood test, or FOBT, abbreviated down to short. This can be picked up on very early symptoms of bowel cancer before there have any visible signs that I've just mentioned as well. This test will involve taking a poo sample and getting it checked at a lab for any signs of blood. If you are doing the test at home, the sample can be posted to a lab, and the results are sent both to you and your doctor. If you're at that high risk stage or the initial screening test comes back positive, however, your doctor will discuss the next steps, which might be looking for polyps with an endoscope or having a CT scan look around for tumours around that region. Okay, there is in New Zealand in Waitemata, the HB district health board district or whatever area, if you're aged between 50 to 74, they should have been invited to take part in the free bowel screening pilot program. But if you live outside in this area outside of New Zealand and want to do the screening test at home, you may be able to buy a DIY bowel screening test at your local pharmacy, so to speak. Okay, last but not least, there are treatments of options available depending on the size and stage of the cancer. Obviously, you'll be offered different treatment options. For some, polyps or tumours might be removed. If the cancer is more advanced, however, your doctor will help you choose the best treatment combination from some of these options. Medication is number 1, number 2, surgery, number 3, radiotherapy, and number 4, chemotherapy. This will depend on, again, the stages and level that your cancer has progressed into this organ, so to speak. It's like that with any other symptoms, or shall we say other areas as well of the body, that when it comes down to certain treatment options. Well, this is a real short and brief overview of the Men's Health New Zealand, obviously all about bowel cancer. Gonna make it short and brief as much as possible, but I can make it further developmental, longer if you want it. Just give me a heads up by commenting below. If not, just say hello and just give me the heads up that you're engaging by thumbing up for support and engagement. Feel free to subscribe to my channel if you haven't done so. Feel free to follow me on Twitter, Facebook, AspieAnswersAll for more updates of what I've been up to, or just following me so that you can get notified when my next videos are up, because like I said, can't always guarantee because I need to be sorting out my end of what's going on. Feel free to also just share my videos around to family and friends for educational, motivational purposes, or whatever purposes it may be. So thanks for the support, thanks for watching, do what you love what you do. Until next time, Aspie signing out. Ciao for now.